Okay, today we're going to be talking about ultrasound, and here's a chart that I'm going to be providing everybody after this presentation in regards to ultrasound. And just like it says, it's a decision-making chart for ultrasound treatment parameters. So some things that we're going to go over today or some components is, first is, the duty cycle. And when we're considering this duty cycle, when we go over this, is you want to just some things to think about is, do you want a thermal or non-thermal effect? And then also we're going to be talking of things such as the frequency. Some questions you might want to ask yourself is like, what's the depth of tissue we're trying to affect, the intensity on how much we're trying to increase the tissue temperature, and also the duration, as that's going to play an effect of all these other components as well. So we're going to get started. So the first thing we're going to do is we're going to start from the top of the chart and we're going to work our way down. And so the first thing we want to consider is, what is our treatment goals when we're trying to apply ultrasound? Is it soft tissue shortening, or is it delayed tissue healing, prolonged inflammation? So this thermal this non-thermal side is talking about the acute phase of healing, and so that's when we're going to be using this non-thermal component. If you're wanting a increase in temperature, a thermal effect, we're going to be on this side of the chart. So we're going to be choosing 100% duty cycle, and like I said, for the acute healing phase, or if there's a prolonged inflammation, we're going to be using the non-thermal, the 20% duty cycle. Okay, so that is if we want thermal or non-thermal effects. So nextly is, we got to wonder, what is the depth of our problem? Is it and this gets back to the anatomy component, is it 1 to 2 centimeters, or is it greater than that, up to 5 centimeters? And so that's going to indicate on what kind of frequency you want to use in regards to thermal or non-thermal. So if you're working on some deep structures, let's say 3 to 5 centimeters, you want to use that 1 megahertz. But if it's 1 to 2 centimeters, it's kind of more superficial area that you're wanting to treat. You want to use this 3 megahertz component. And also we got to mark note that the 3 megahertz, when we use that, it's going to increase the temperature 3 times more than what it would for 1 megahertz. So that's going to go right back into what we're playing with, the intensity component. Like I said, is 3 megahertz is going to increase temps 3 times more than 1 megahertz, and the theory behind that is because this is more superficial and what you're treating. And then so as we're choosing our intensity, things we want to think about is, like I said, the treatment goal. What are we wanting to treat? And like, if we're just wanting to increase the temperature by 1 Celsius, we're just going to increase the metabolic rate of tissue. If it's 2 to 3, we're going to increase the blood flow or decrease chronic inflammation. And if it's 3 or 4 Celsius, if we're going to increase the tissue temperature greater than 3 or 4 Celsius, then that's going to be in regards to stretching. And so I'm going to be showing y'all some neat tables I'm going to provide y'all as a handout. And here's one of them, or both of them actually. The tables is the intensity, and as we see, the 3 megahertz is going to increase the tissue temperature per minute a lot faster than the 1 megahertz. And so we're not going to be having our time as long, or we need to decrease the intensity depending on what kind of treatment goal we're trying to do. And then also, this is a beautiful chart as well, is here's kind of the rehab implications of why you would want to use the duty cycles over here on the left. And like I said, if we want to increase the tissue to 1 Celsius, this is for subacute injury, hematoma. 2 is for chronic inflammation, pain, trigger points, muscle spasms. And then if we want to increase it to 4 Celsius, we're going to be stretching collagen. And so, as we see here, the duration of treatment is going to be 5 to 10 minutes, and we want it only 2 times greater than the effective radiance of the transducer head that produces the sound waves for the ultrasound. So those are things to keep in mind of while we're using these parameters for ultrasound, is just the treatment goals, why we're using them, and what we're targeting, and how hot or the thermal